As more vaccines become available across the state, we are seeing how health departments are adapting their strategies with the rollout. News 8's Lindsay McComal joins us in studio to explain.
Brian, the main focus does remain on getting shots into arms, but just like any new responsibility that you adapt to over time, clinics are becoming to feel more like a routine for health departments, and therefore they're identifying shortfalls and working on ways to perfect the process.
We're kind of getting into a groove with our clinics.
Marcus Cheatham is the health officer for the Mid-Michigan District Health Department, serving Montcalm, Gratiot, and Clinton counties. He says it's finally feeling like they've hit their stride with running clinics, partially because supply has roughly tripled in the last 2 months. Right now, they're really focusing in on that outreach.
We realized we just need to do more of that, leafleting in front of a grocery store, just those kinds of things, especially to reach the seniors.
The same thing is happening in Ottawa County, where they've noticed eligible people outside that 65 and up priority group aren't necessarily showing as much urgency to find a vaccine.
We are seeing that maybe not as many people are as anxious to get the vaccine. So what we do is we've been working closely with employers, also different nonprofit agencies, faith-based organizations, to really open up those lines of communication and find out what are some of the hesitation or concerns. How can we help to provide more information?
Waymink also shared their approach to any leftover doses remaining after clinics end for the day.
We have what you would call like a wait list and a list of people who can get to the clinic quickly, who are eligible, who may not have been able to get an appointment but are still anxiously waiting for the vaccine.
Allegan County is also taking that approach if there are remaining doses. Plus, the county transportation department is now offering free rides to those 60 and up who need help getting to their appointment. Now, while some providers are in a position to be calling people when they do have extra supply, we're also hearing some folks are resorting to traveling outside of their county or the state altogether to get a shot. I asked the state about that today and received this response. We asked that Michiganders contact their local health departments and pharmacies first for vaccination before traveling to other parts of the state or out of state. However, no shot in the arm is ever wasted, as getting this vaccine is our way out of the pandemic and returning to some sense of normalcy. Brian.
Lindsay McComal, thank you. And as vaccination efforts continue, our state confirmed another nearly 2,100 cases today and 23 deaths. 16 of those deaths were found in a records check. The rate of positivity more than 4.4%.